heavy bleeding, bloating, pain, and fatigue, yet no real answers. Let's talk about what your fibroids are really saying physically, emotionally, and spiritually. I'm Dr. Holda Weinstein, board certified OBGYN, and this is the Inner Temple. Welcome to the Inner Temple. This is your sacred space to come home to yourself. Here we explore the truth of your temple, your body, your mind, your emotions, your soul. My intention is simple: to help you remember who you are in all your glory, and to teach you what you were never taught about your health, your hormones, your cycles, your symptoms, and the sacred wisdom underneath it all. So grab your tea, wrap yourself in your softest blanket, and get cozy with me. You and I are about to have a soul-nurturing, heart-awakening conversation about your temple. Hi, my loves. Welcome back. Welcome back. This is week 3, the third week of the Inner Temple. I'm so grateful to be with you, to be in your space. I'm grateful that your temple matters to you and that you're ready to do something different on your healing journey. For those of you who don't know me, I'm Dr. Amy Holda Weinstein, but you can call me Dr. Holda. I am a board-certified obstetrician and gynecologist and the founder and medical director of Visionary Women's Health. We are doing some pretty nice things, but we're not going to dive into that today. If you're curious, you can certainly go to visionarywomenshealth.com. You can read all about us. I am a healer, first and foremost, a physician, but I know from direct experience with myself and with hundreds of women that when we heal all parts of ourselves, physical, mental, emotional, and awaken our spirit, miracles happen. I've had miracles happen to me. I've had my own medical conditions completely reversed. PCOS, some back issues, imaging going drastically changing, and it does not make sense to the medical eyes looking at it. And I've seen the same for my patients. And this is why I believe in holistic care, because this is where what we deem as miracles lie. But they shouldn't be out of the norm. They shouldn't be miracles. They should be everyday occurrences. And this is what I hope to bring to you, and I am so glad to be here with you today. So before we begin, we're always going to set our intentions together. So if you want to go ahead with me and take in a big cleansing deep breath and close your eyes, and we're going to set our intentions. We enter into the space, this sacred space, awake and aware of the infinite light, the one infinite light that also lives within us. In the stillness, we connect soul to soul and evoke the power and spirit of unconditional love to heal all shadows, all imbalances, all wounds, and to actualize the miraculous healing we seek and that we are, and to celebrate into infinite life. All right, you can open your eyes. For those of you who have been here before, you know that I always like to set that intention. I do it with all of my clients, and it really gets us to feel each other's energetic fields and to benefit from each other's energetic, unconditional love. So I hope you're well. I want you to get comfortable. I, as always, have my tea here ready. If you prefer something else, please feel free. But get cozy, get comfortable. We're going to talk for a little while, you and I. And I want to empower you with some knowledge. And I want to also get you to open up to a sacred space where we can explore your emotions and your mind through the lens of your spirit. So today we're talking about fibroids. Now, most have heard of fibroids, but I find that not everyone fully understands it. Even patients that come to me who've been managed elsewhere, sometimes I've never had the location of their fibroids explained to them, and why does that matter? Or even have their fibroids monitored, or have a conversation about what can be done for their fibroids outside of surgery. Fibroids are benign tumors, and that just means they're generally non-cancerous, because if they are, they become something else, leiomyosarcomas. But a fibroid, or a leiomyoma, is non-cancerous, and it's a fibrous tumor that is growing in a uterus that is a soft muscle. And so they almost behave as rocks that are sitting in the uterus. Now, they can grow in different locations, and location does matter, so does size. Some of them grow right under the skin of the uterus. Those are called subserosal. Those generally tend to cause a lot of pain. And then some will grow in the muscle or the wall of the uterus. And those can cause a combination of pain or bleeding depending on their size. Some of them grow right inside the cavity, where a baby would grow. And those are notorious for causing heavy bleeding even when they're tiny. Some of them hang right off the uterus, call those pedunculated. They're fun. And those generally will cause what we call bulk symptoms, where they can start to push on different organs, the small intestines, the bladder, the rectum. So depending on where they are and how big they are, you can start to have symptoms elsewhere with urination, constipation, gassiness, bloating. And then you have some more rare ones that tend to grow in the cervix and other locations that aren't as common and that can cause other issues. But the ones that I mentioned are going to be the most common locations. So if you're ever told you have fibroids, one question you should ask is, where are they located and how big are they? Now, the question, how many do I have, sometimes can be answered. But some patients have so many that it's hard to count all of them and to really differentiate which is which on an imaging. Certainly the MRIs do a much better job, but not everybody needs an MRI. Generally, I'll order that for surgery when I'm trying to plan the approach. We'll get the MRI. Now, when we talk about treating fibroids, what we are taught and our general approach is that you treat fibroids when you're having symptoms. And symptoms are going to be heavy bleeding. Usually that will cause anemia, which is problematic and therefore should always be addressed, or pain. Now, some of the bulk symptoms that I mentioned can look like other things, such as frequent urination, trouble defecating or constipation, bloating or gassiness. Those are all other symptoms that you can get as well, or this feeling of this constant pressure, bloating, feeling like you're pregnant, just this uncomfortable sensation in the abdomen. And then I have some patients with very large fibroids who have absolutely no symptoms. Cycles are normal, no pain, no bulk symptoms. One patient comes to mind that had a 20 centimeter fibroid. Her uterus was, of course, very large, and she had no symptoms. She was just walking around looking very pregnant, but had no symptoms. She did eventually get surgery, but she just kind of walked around with that for a few years and didn't need to do anything about it. We were talking at the time about some things she can do with her lifestyle and her diet, and she kept that fibroid pretty much the same, and it shrunk a little bit, but she did eventually, like I said, get surgery. So if you have symptoms, then you should be having a conversation about treatments with your doctor. And having heavy periods that leads to anemia is one of them. Sometimes what I commonly hear, especially in my community, my African American women, is they have anemia and they're seeing a hematologist and they're getting some iron transfusions and doing all these things, but they're not really connecting the dot with treating their heavy periods. To them, the period is just heavy, and that's just normal. But a heavy period that causes anemia is not normal, and you should do something about the heavy periods. And so there are a couple of options out there, and we're going to talk first about some of the lifestyle changes that I think are going to be beneficial for you. Now, what I find with the lifestyle changes is I do see patients who are able to notice either they're able to keep the size of their fibroids stable, or they're able to start to shrink the fibroids. But not all of them will achieve a symptom relief with lifestyle changes alone. And this is where some of the other things we're going to talk about can be helpful for you. The main lifestyle change is going to be following a diet that is going to reduce the estrogen stimulation to the fibroids. The main theories around fibroid development is going to be estrogen stimulation and inflammation. So following a non-estrogenic anti-inflammatory diet is going to be the way to go. And again, we go back to our whole plant-based foods. The way that we were meant to be eating as human beings is never going to steer you wrong and is always going to serve you. There are certain herbal supplements as well that are very helpful for fibroids. And again, if you are in the Awakened Medicine community, you will find those resources. But I want you to use those under the guidance of a provider who understands herbs, because many of these can be very strong. And there are many that are so strong that they will actually lighten your periods and help with your periods. One that is common and perhaps doesn't have as much side effects that I'm going to list here is called Chaste Tree or Vitex. And it's really nice because it helps with the progesterone support. And progesterone is one of the friendly hormones here when we're trying to manage some of the symptoms with fibroids. Now, some of the other ones that are out there that I use, I'm not going to mention here because I don't think they're suitable for everyone, but they are suitable in the right patient. And that's where kind of going through the resources and kind of reading a little bit more about each one and in what situation they would be helpful for you and who it's safe in can be very, very useful. Now, the world of treatments, medical treatments, is actually much broader than a lot of women have been led to believe. A lot of women hear, well, you have to get a hysterectomy or you have to get a myomectomy. And especially African American women who are 2 to 3 times more likely to only be offered a hysterectomy when dealing with their fibroids and none of the other treatments, and therefore sometimes get unnecessary surgery. It's important to hear some of these other treatments that you can get and ask for. Let's start with just the simple ones, and these are medications that you can take orally. Some of the birth control pills, again, you want to use the ones with the right progesterone, can be very helpful with the heavy bleeding and therefore some of the pain that can happen with the fibroids. These pills are not all the same. We have combination pills that have both progesterone and estrogen, and then we also have those that are just progesterone. And the ones that are just progesterone are very helpful with this estrogen dominance that happens in fibroids and that overstimulates the growth of the fibroids, and also really good with managing the heavy bleeding. For that reason, the Mirena IUD or some of the hormone IUDs that have progesterone can be very helpful as well. Now, these can be tricky with fibroids because if you have one that's in the cavity or that's pushing in the cavity, that may cause some complications with your IUD. So definitely something you want to talk to your provider about. But again, another reason why it's important to know the location of your fibroids. Now, there are some minimally invasive procedures that can also be done with fibroids. Some use ultrasound technology to heat the fibroid and help it shrink. You can also get a intervention with a radiologist called a uterine artery embolization, where the radiologist will cut off the blood supply that's heading to the fibroids, and that will cause them to shrink and shrivel up, and generally your periods will also go away with it, or will get very, very light. And of course, you can always get a myomectomy, which is a removal of the fibroids, especially if you still want to keep your uterus. Now, it's important to remember that when we're cutting into the uterus to take a fibroid out, it's a very bloody surgery. And so it's actually safer to do a hysterectomy than it is to do a myomectomy. Therefore, if you truly do not need your uterus any longer, meaning you are done with kids, generally a doctor is going to advise that you just get a hysterectomy. But always understand that you can always just ask for a myomectomy, but understand the risks involved when you're choosing that versus the hysterectomy, especially if you don't have a reason to necessarily keep your uterus. Now, because we're in the inner temple, a common question I often get is, well, I hear that if I get my uterus out, then it's going to negatively impact me spiritually because the womb has a lot of meaning and significance, and I absolutely agree. However, I also believe that we are powerful beings, and that what happens to us energetically and the balance that we achieve is in our own hands. And I have some spiritual mentors who've had hysterectomies, and I can tell you they are not lacking in anything that the womb was holding on to. So I don't want you to be paralyzed by some of these things that are said out there in the community. I want you to always return to your power and to know that you can achieve balance in any condition. So if your clinical situation is such that getting a hysterectomy is just what's going to be better for you, potentially life-saving, then certainly don't let some of those talks keep you from doing that. Now, let's dive in to what I often observe is happening energetically, emotionally, in the mind, in my women with fibroids. Now, I want you to grab a pen and a paper if you haven't already, and let's talk about the spiritual consciousness underlying fibroids. What I find often is that fibroids generally manifest in a woman that is repressing rage, feels like they are being silenced, that they have some trauma, some inherited pain sometimes. And I don't think it's a coincidence that as African American women, we have a higher incidence of fibroids. And it has to do with our ancestral trauma and that story that we continue to hear as we bear the burden of the consequences of being the Black woman that is still expected to carry everyone, yet is still undermined, disrespected. The ancestral pain and the rage that we have within us over what was done to our bodies, to our children, to our families, is directly related to the manifestation of fibroids. And so I want you to think about in your own life the stories that you never got to finish to tell, the pain or the rage that you never really got to process. Maybe some trauma that you were just kind of told to accept. Just get over it. Think about if any of those things come up for you. And take some time, take your note, write them down. And I want you to connect to the rage that lives in your womb. And if you're part of Awakened Medicine, you probably have already done this exercise or will be doing it very soon. But it's listening and connecting directly to the womb and not judging it or fighting it, criticizing it, being angry with it, but just allowing it. And allow the rage to come up to the surface and to get a voice. So I'm going to give you 3 questions that I want you to ask yourself. 3 reflections for yourself or maybe someone that you know that has fibroids, so they can begin to heal this part of themselves that is asking to heal. So the first question is, what truths, emotions, or desires have I been holding in my womb instead of expressing? What truths, emotions, or desires have I been holding in my womb instead of expressing? And the second question is, where in my life am I giving life to everyone else, but not myself? Where in my life am I giving life to everyone else, but not myself? And the third question you're going to answer is, what patterns or burdens am I carrying that no longer belong to me? And perhaps they were even from generations before me. And for Black women, this is a big, deep question. It's a question that I'm addressing in my book that's upcoming, Black Soul Heal. But as Black women, we've carried many burdens for way too long that don't belong to us anymore. It's time to let them go. If all of this really resonates for you and you feel like this is it, there's something here for me that I need to release, I can tell you that your intuition is correct, but I can also tell you that you're going to have a much better result when you go through a systematic process that addresses all parts of you. Because this will be connected to another wound, and that will be connected to another one. And this is why many people kind of are running behind, all these different wellness and healing. They'll heal one thing, but then this other thing pops up. And what we do in Awakened Medicine is we just start from the beginning. Everyone heals all parts of themselves. Because unfortunately, in the society that we live in, we all have some pieces that are not quite aligned in every aspects of our being. All we're doing is realigning. So if you're being called, you feel called to take a journey deep inside your temple where you can realign your mind, your emotions, which are the sacred messengers between the mind and the soul. If you are ready to awaken your soul and start living like the true human being we were meant to be, then join us in Awaken Medicine. Until the next time, my loves, I am sending you my warmest love, all my light. And I want you to always remember that you are the one. Take care.